Dr. Wellwood here and
Dr. Mazzaferro
at the Natural Health Center and Regenerative Medicine Institute, Medical Lake, Washington. So today's your daily dose, and we're going to talk a little bit about some most up-to-date recent research on various topics. We're trying to keep it quick for you guys because we know everybody's busy, but we also know that a lot of people actually talk to me about this on a daily basis. So whenever we put these out, I kid you not, I get a couple of people actually asking them about this stuff. So that's nice to see.
Yeah.
If you guys have any comments or questions, don't forget to post them down below. I do try and look at each one of them and try and respond to them. So don't feel that you're going to be unheard, because I promise you, you are heard. So what else we got for today, Dr. Mazzaferro?
We got a few interesting things. I'll start out with one quick one. Interesting. It was posted in the Biofilms and Microbiomes in March 2018 edition. And it's saying that rubber duckies pose a bacteria risk. I know it's kind of random, like chiropractors talking about this, but I thought it was interesting because it says they collected a bunch of these from homes and studied the bacteria on them, and found that it was really common for the bacteria that is on these the rubber duckies to be the same kind that causes ear infections. What else was it?
GI, I think it's said too.
Yeah, eye, ear, and intestinal infections. So it's like, just it'd be a good idea to wash with it once in a while,
Well, it makes sense. I have 4 kids.
Yeah.
And I guess, you know what? We actually do have quite a lot of rubber duckies in my house.
They can get a little nasty, a little funky over there.
So, right, I know. So the question is, we don't give our kids bath that much, but every once in a while they do. But it makes sense why they would actually have eyes, ears, and intestinal stuff. Because what are you doing? You got a sick, nasty kid who's got... let's be honest, people. You got poop and pee everywhere sometimes, right?
Yes.
And then you stick them in a tub with rubber duckies, and the duckies are going to have all the poop and pee that's already on there.
Gotta wash that ducky.
Right. And what do kids do? They stick their face in those bubbles, and they drink it all because they're having fun, right?
Yeah.
And as you as the parent, you're like, more bubbles, because they're having fun.
Yeah, they love it.
So I guess it totally makes sense. I would actually,
Yeah.
I never actually put that to my brain before. I don't know why. Yeah. Okay,
Makes
whatever.
Sense,
So clean with 10% chlorine. So I was going to say chlorhexidine. That's what I use for injections, but chlorine.
Clean that ducky.
Clean that suckers up, man.
Story.
Because it's kind of gross.
Yeah.
So they're drinking their own poop. Ew, gross.
Don't do that.
Oh, that's nasty. That's nasty.
It's not advisable. All right, so the next one I think is interesting. This is posted in the Journal of American Heart Association and very recently, and it has to do with coffee and in relation to cardiovascular health. And so in this new study, the researchers studied 4,400 coffee drinkers, and specifically those who drank 3 or more cups of coffee a day. And they found that those who drank this amount of coffee a day tended to have less calcium buildup in the arteries in their heart. Now they do say further research needs to happen before they can definitively say there's a relationship here, but it's looked promising, and it's definitely something that's going to be investigated in the future. So keep up the coffee. Could save your heart.
Now, I'm not a coffee drinker. I do drink coffee every once in a while, but it has to be one of those sweet ones that I don't really think they construe as coffee.
Basically like a milkshake.
It's like, it is.
It's like dessert.
It's like so good.
It's so good. Yeah.
We have a great local coffee place. I love them. So how many cups of coffee do you actually need to drink?
For this?
Yeah.
They said 3 cups or more a day. So at least 3.
Yeah. So for you guys who drink a crap ton of coffee,
you're in the clear.
Yeah, you're apparently your heart's doing good. So that's a reason. I mean, you might have the jitters all over the place every time, but
shaky.
Yeah. I can't. It's too bitter for me. It's like beer.
Yeah.
I refuse to drink something where I have to get used to
acquired
it.
Taste.
Acquired. What's acquired taste?
It takes work.
Why would you acquire a taste?
I guess for the caffeine benefits.
Yeah. You got tea.
Get you going.
You tea. So one of the ones that I read up on was actually on multiple sclerosis, and it was Journal of Alternative and Complementary Medicine. And what it actually showed was, it didn't actually show there was a correlation between getting adjusted and feeling better for multiple sclerosis patients, but rather that chiropractic is one of the top 3 that multiple sclerosis patients actually see. And if you guys know me personally, or if you ever come into the office, and I hope you do, that you'll actually find out that my wife, who is a psych nurse, by the way, has been suffering from multiple sclerosis since she was 21, 22. She was a vet at the time, so she was an Air Force vet, and Multiple sclerosis sufferers are very near and dear to my heart, and we treat a lot of them here consequently for that. We've got a great relationship with one of the best MS doctors in the area, and Dr. Stephen Pugh at Northwest Neurological, and luckily he's able to get you guys in quickly. So a little bit about, not about chiropractic and stuff, but about low-dose naltrexone. If you have multiple sclerosis or any type of chronic pain or any type of rheumatoid or arthritis, whatever it is, or even if you're an opioid addict, check out low-dose naltrexone. It is amazing. My wife has been on it for years, and we actually had to give a whole bunch of research to Dr. Pugh. And after that research, he actually started giving it to a lot of his patients. So that's how good of a doctor is. But by the way, he actually took up the most recent research and changed a little bit about his practice and added some stuff. So that's how it should be, right?
Yeah.
You would think so.
Yeah. Stay up to date.
So that's all me today. Anything else?
No, I think that covers it.
Cool.
Pretty good, yeah.
All right, guys. Till next time.
Bye.